I guess just first off, kind of talk about what Sedgwick County is doing right now when it comes to just addressing COVID-19.
So what Sedgwick County is doing right now, and once again, with the health department, we are always focusing on reducing the spread of disease and monitoring our country and our state and our community for any threats that might come. And so in regards to COVID-19, we're in constant contact with our state health department as well as the Center for Disease Control and Prevention. We are also in contact with our community partners, medical and health partners. We're having an expanded meeting this week with our safety partners, public safety partners and medical, just to make sure that we're on the same page, looking at the amount of resources that people have and what they might need, and at what point then that if it comes to that we reach out and get additional resources. We have activated our internal incident command system, and that just means that we are focused on coronavirus and the COVID-19 and responding to it. And what the ICS structure does is creates a very specific structure for communication, because there's lots of moving pieces in any type of outbreak. So we have over 20 of our staff just dedicated to various aspects. And right now it's very minimal, because outside of our epidemiologists, because COVID-19 is not in our community, it is not in the state of Kansas, but it is coming. And so we are going to be prepared for that when it does come. We are providing information to our community through our Sedgwick County website and health department website. We have a fact sheet that we are updating as any important information comes. We stopped updating as numbers changed, because numbers can change several times throughout the day or minute at this point. So we are really acting as a main point of information for our community.
And you mentioned measles and N1H1. How have those incidents kind of served as preparation for what's coming or could be coming with coronavirus?
Well, it provided real life experience, and we have our own emergency operation plan. We have a pandemic plan, as other partners do, and so it gave us an opportunity to just not read about it or exercise, but to actually put that into place. So our excuse me, our hospitals and other partners have been, practicing and doing real life practice, even with when Ebola was a fear here in Sedgwick County. Our hospitals were very on target and ready for anything that would come into the community. So the important thing with all of our partners is really for all of us to be on the same page, and for there to be constant communication, because the more unified we are, the more successful that we're going to be. And we have a really strong public health partnership and medical partnership in our community.
What do you think of the federal response to this virus?
I wouldn't want to be the CDC or the federal response right now, because they have had an extremely difficult task, and that's trying to stay on top of something that at the time they knew nothing about. So the important thing at this point, and the federal government, the state governments are working very hard on containment of this disease, as they always do. So we know that regardless of the efforts, it's now community spread, and we are preparing for that.
What about like the travel bans and those sorts of things?
The travel bans are an effective way to try to minimize that spread, and they may continue to increase as far as the number of countries that are at that level 3, and the level 3 is that no non-essential travel should occur.
When it comes to testing too, how would that kind of process be handled by the health department as well?
Well, currently we're not able to test. The Center for Disease Control and Prevention were the ones that were doing the testing, but they've created test kits that are now in the hands of local health state health departments. And so the state health departments are able to test, and so the turnaround time is much more quickly. It's not going to be days before we know whether someone is positive or not. And at some point, there should be test kits available to be sent into communities as well.
And if there is a case local, you said kind of quarantine at home or self-quarantine is kind of like the recommended course of action right now. Just kind of how would you monitor a case, I guess, in this kind of situation?
If they're not symptomatic, then we would be talking with them about symptoms to look for, and they would be self-reporting, taking their temperature, reporting symptoms, and we would be in contact with them. And then if they started developing symptoms, then they would likely be tested.
All right, anything else?
I would just like to remind people that even though this is scary because it's new and there's a lot of unknowns, that the flu the coronavirus or COVID-19 is coming, the flu is here, and it is active. And there's still time, even though March seems really late to get a flu shot, there's still time to get a flu shot because people are out at the health department currently with the flu. So it is alive and well. And hand washing, I can't stress, it just seems so simple and people don't want to believe it, but hand washing is the best prevention. And our health officer this morning said, at some point it might be that you don't want to, that we're bumping elbows versus shaking hands, but just because we are human and we forget and we touch our face, and that is how it is spread, by touching our face after we've come in contact with the germs.
You said going forward, you're hosting weekly briefings as well?
Weekly briefings. I'll be doing weekly briefings at our Board of County Commissioner meetings on Wednesday morning at 9 a.m. And also we'll keep our fact sheet updated on the Sedgwick County webpage and the Health Department. And again, for the community, when they have questions about COVID-19, to call United Way 211. We are working with them and they're able to answer questions. And if 211 does get a question that they aren't able to respond to, then they will contact us, we'll give them the information, and then they will be able to respond to it.
I do have a question. Just to clarify, 7 types of human coronavirus, including like a common cold. So when do you move forward if someone just has a cold to go into testing for the coronavirus or something like that?
There's going to have to be certain factors that they meet, like where they've traveled, if they've come into contact with someone, and also their symptoms, because some of those criteria are evolving, because it's beyond just testing people if they were in China or Italy or one of those other high-risk countries at this point. So once it's evolving and once it comes into our community, I imagine, and before then, that there's going to be expanded guidelines for who to test and when to test. So that is currently being developed.
Has anybody been tested in Sedgwick County?
Yes, we had 2 people that were under investigation. No, sorry, not in Sedgwick County. In the state of Kansas, there were 2 people that were under investigation, and they tested negative.
That was Lawrence.
So we don't, just the state of Kansas. So, and again, we don't have any cases in Kansas at this time. It is coming, just as the flu does every year. There's a lot of things that we don't know about it again, and as we learn, we will share.